morning. Thank you all for being here. I'm Bruce Cruiser, Executive Director with Mental Health Virginia. And NAMI Virginia, Mental Health Virginia, Voices for Virginia's Children, and Vocal Virginia have come here today to elevate the urgency of mental health across Virginia and across the lifespan. Unfortunately, NAMI could not be with us today due to illness. However, they are very much a partner in this whole endeavor. Since 1937, Mental Health Virginia has worked to improve mental health for all Virginians. And this starts with increasing public awareness that mental health is part of everyone's overall health. And if you're not feeling well, the sooner you talk about it, the sooner you can get the help you need, and the better the outcomes. But far too often, the help you need is not available. As a result, too often we have defaulted to the overuse of hospital emergency rooms and jails. Now, our historic failure to provide a full continuum of community care has had drastic consequences. It means we incarcerate some individuals in a mental health crisis because we have nowhere for them to go. And Virginia is better than that. We need common sense criminal justice policies to divert individuals with serious mental illness to the treatment that they need. We need to fully fund the current plans for community crisis care, treatment, and recovery services throughout Virginia. Every person has a right to mental health.
Hello, I'm Heather Orrock. I'm the Executive Director of Vocal Virginia. Thank you all for being here. At Vocal Virginia, we believe that the strongest advocates are those that have walked the path themselves. As the only statewide mental health advocacy and education organization that is staffed and led by those with lived experience, we understand the firsthand challenges and opportunities within the mental health system. Our mission is simple, yet powerful. To ensure that those directly impacted by mental health challenges have a meaningful voice in shaping the policies and laws that affect their lives. This work isn't just about advocacy, it's about building a community where lived experience is celebrated as expertise, and every voice is valued and celebrated, creating lasting positive change. Together, informed by this experience and united by purpose, we can continue to transform Virginia's mental health system. Thank you.
Hi, good morning, everyone. My name is Rachel Dean. I serve as Chief Executive Officer at Voices for Virginia's Children. We are the state's only multi-issue policy advocacy organization dedicated to the well-being of children and young people. Thank you to Senators Deeds and Boysko and Delegate Coiner for being here today as mental health champions for our young people and families. This morning, I want to focus on the unique needs of young people in the mental health and behavioral health care systems. The Right Help Right Now plan has been a really strong showing of bipartisan support, interest, and investment in transforming our mental health care system. We know that that system needs to be transformed for adults, for young people, for all in Virginia. But today I want to talk about the unique needs of children and youth and their unique resilience that gives us hope for a better tomorrow. We've heard about a youth mental health crisis. We've heard about gaps in access to care, and young people are particularly at risk of falling through the cracks in our system. As reported by our partners at Mental Health America, in 2022, 54.5% of youth in Virginia who reported suffering from at least one major depressive episode did not receive any mental health treatment. I can attest as a parent of 2 young children that finding care for my own children has been difficult, even though I have a law degree and access to excellent health care. I've had to resort to paying out of pocket for therapeutic services at great cost, as many parents across the Commonwealth do, because what would we not invest for our children to be well and to be thriving? And that's the question we are asking lawmakers to consider as well. We know it's important to make investments across the entire continuum of mental health care, At Voices, we are deeply invested in the success of school-based mental health. When I say school-based mental health, I mean the provision of mental health services within the school environment where our children learn, play, and create relationships. We will talk a little bit more about some of the work we are doing to try to rededicate some funding to school-based mental health integration, to develop performance measures for that programming, and to ensure that we can allow our school divisions to leverage Medicaid dollars for that as well. Finally, I do want to say young people are full of promise. We hear about a youth mental health crisis, but what I see in my work is young people fighting, standing up for themselves every day, showing a great deal of resilience and optimism, and really calling for destigmatization. And I want to follow the lead of those young people. Thanks for being here today.
Yeah, I'm Creed Deeds on the state senate. It's been my goal for many years to make sure that we have a system of healthcare that meets people where they are and keeps people out of crisis. We focus too much on the crisis. The reality is right now we are in crisis. We've got, coming out of the pandemic, we've got a terrible crisis with young people that we've got to address. The intersection of criminal justice and mental health still is an awful place to be, and our jails all over Virginia are too full of people who simply are sick. We've got to figure that out. But we can't figure out anything if we don't address another crisis, and that's the crisis we've got a workforce right now. Every locality in Virginia is medically underserved from a behavioral health workforce standpoint. We've got to focus on making sure we have the right numbers of professionals distributed around Virginia, and that our laws are work well enough that we can provide services even when we don't, through telehealth. We've got to be able to provide health care wherever we can. So I'm committed to getting that done, and we've got huge challenges with the budget this year, even though there's been a lot of noise about a $2.2 billion surplus, and I've been here long enough to know that we have plenty of years of shortfalls. And $2.2 billion of surplus is a one-time thing that we've got to be very careful with. We've got to make the investments that will pay off for us over the long haul and help people get well. Thank you for your interest, and I want to say thank you to the advocates, thank you to parents and families and people that have lived experiences that make a difference every day in trying to make the lives of other people better. Thank you. Delegate Coyne.
Thank you, Senator. Good morning, everyone. The area of mental health, we've heard a lot about, and you're going to keep hearing about the individuals who are experiencing mental health crisis or those struggling with mental health concerns in our communities. But I hope it's also not lost on us that it's not just the individual, but the families surrounding that individual who are impacted. When you are living with a loved one who is struggling with mental health illness, it impacts children, it impacts spouses, it impacts brothers and sisters, aunts and uncles, grandparents. It impacts a much larger circle. And everything that we can do to help an individual who is struggling and has needs, we are building up and building resiliency amongst many more people connected to them. I will echo about our workforce needs. I tell young people all the time, you cannot be what you do not see. And we need young people throughout the Commonwealth to see quality providers doing great work and aspiring to those career paths in our high schools and going on to continuing education. We need to make it worthwhile to be a mentor in these fields, that you don't feel like you have to turn down seeing patients and helping people in order to help the next generation be able to serve and care for our community as well. And that there is time dedicated, and it is honored that it is an important thing if you're a great provider that we help you do that. I will echo the sentiments as a mom of 3 teenagers. It is a struggle to find providers if you cannot 100% pay out of pocket. And that is not a place where we want to be, that only those who have the income and the ability to pay a full amount to receive services are able to get that. And we need to work on that. We need to have hard conversations with our provider communities, with our local government, state and federal, about how we ensure every family in Virginia, regardless of where you live and your income, has access to the same quality care. So thank you for being here and caring about this very important subject.
Good morning, everybody. I'm Senator Jennifer Boysko. I represent the 38th Senate District that is in northern Fairfax County. And I want to let you know that I have a lot of constituents who call my office throughout the year asking for help. There have been moms and dads who have reached out to us who have children in crisis, who can't get a bed, and just continuing those conversations to try to help make sure that they have the resources. It's been something that we spend a lot of time on throughout the year. I've also worked with a lot of families who have children who are neurodivergent, who have autism and developmental disabilities. And one of the things that we hear the most, from that population is that they have very unfortunate interactions with law enforcement. And so for a number of years, I've been working on a bill that would allow them, right now, if you could, spill a glass of water on an officer and get a mandatory minimum felony. My bill that I've been working on would allow an affirmative defense so that if that happened and they could prove that their behavior was attributed to their mental health crisis or their autism or other neurodivergent diagnosis, that they can have the opportunity to go before a judge and petition not to be sent to jail and have a mandatory minimum. Of course, they would be held responsible if they did harm someone, but that's not the case in most of these. I've also been working on issues around providing funding for all of the behavioral health professions, because even though we've met the DD waiver, we've added to our DD waiver slots, we don't have all of the professions, and so that's something that the General Assembly continues to work on. We recognize in the General Assembly that our loved ones in our communities are struggling, but there is a crisis here, and it is incumbent upon us to rise to the challenge, and that's what all of us are doing, and with your help, we're gonna make it. But I thank all of you for being here.
Good morning. I'm State Senator Barbara Favola, and first I'd like to thank those who organized this presser, because the topic could not be more important. I do have the privilege of serving on the Behavioral Health Commission, chaired by Senator Deeds, and I also chair the Rehabilitation and Social Services Committee. In that role, or in those multiple roles, it has become very apparent to me that mental health is the key to having a full life, to having a productive life, and actually to being able to thrive. And it is so important, not just to the individual, but to all of our communities. So in that effort, I have looked at the spectrum of services and where we should intervene, where we can be available, where has a government or has providers. We can step up and meet our patient, meet our person where they are and what they might need. So we started very early, in 2018, HRSA, you're familiar with that federal agency, gave Virginia a grant to start what we now call the Virginia Mental Health Project. And that project enables our primary care practitioners, our pediatricians, when they're actually providing services and evaluating the patient. If the patient needs mental health services, they can link on to either a telehealth psychiatrist or other resources, but the point is that services are provided right there in the primary care setting, and it has been proven to be one of the most effective ways of providing mental health services. And then we've transitioned all the way up to ensuring that those who need services identified maybe by the court system, child in need of services, actually get services in a collaborative way with a comprehensive team. And then we go on to my bill. I do hope that finance chooses to pass it. It did pass out of judiciary, but I do have a bill that at the point of screening, well, at the point of sentencing for a juvenile, another screening could be ordered by the judge, and the screening could cover a range of things, not just behavioral health, maybe developmental disabilities or learning disabilities. So we are really looking at we think the child in totality, and we very much support the mission of all of our mental health partners. So, thank you very much.
Good morning. My name is Amanda Lynch. Thank you for the opportunity to speak before you all today about the impact of mental health on countless families across the Commonwealth. Before discussing systemic issues, I want to share a bit about my late husband, Marcus. He was my best friend and the absolute love of my life. Known for his humor and spontaneity, a state champion in high school sports, a Southern Conference record holder from his time on the track team at VMI, Marcus was one of one, possessing a unique ability to make everyone around him feel seen and valued. He brought that same compassion into every aspect of his life, and his spirit is a constant presence in our family. Marcus poured his heart into preparing for our children's futures, always believing his time with us might be limited. His struggles with mental health began after the loss of his father in his early childhood, compounded by other adverse childhood experiences that went untreated. Unfortunately, during that time, in the 80s, few resources existed to help him navigate those challenges. He often felt he was living on borrowed time, and that awareness fueled his desire to protect and love us fiercely. He dedicated himself to creating a blueprint for our children's lives, ensuring they had every opportunity for success. While in crisis, Marcus became the victim of senseless gun violence on October 30th, 2022. His homicide remains unsolved, and it was a devastating blow to our family. In the wake of his passing, my children and I turned to the healing arts and participated in programs through organizations like Comfort Zone Camp and Full Circle Grief Center. We even published a children's book about grief and loss to help other families facing similar challenges. These organizations provided us with the tools we needed to navigate our grief and start the healing process. Research shows that when children's grief is addressed properly and tended to, they are less likely to face long-term emotional and behavioral issues. Grief is an injury to the heart, mind, body, and nervous system. And like any injury, it requires specialized care. Yet funding for these essential programs remains limited, leaving many families without access to the resources they need. Investing in these services is not just compassionate, it's vital for the well-being of our children and our communities. Marcus's story, though deeply personal, is not unique. Families across Virginia face overwhelming challenges when it comes to accessing mental health care. Many children are living in war-like conditions, experiencing toxic stress and emotional turmoil, regardless of their race, income, or where they live. The lack of adequate mental health care deepens their suffering, showing that trauma can affect any child, anywhere. Imagine taking your loved one to the emergency room during a mental health crisis, only to find that there are no available inpatient beds. Imagine waiting for hours, sometimes days, while your family member suffers, caught in a system that is overstretched and under-resourced. This is the harsh reality for far too many families, and it highlights the urgent need for reform. In some cases, families like mine are forced to take extreme measures, such as restraining orders, just to ensure their loved ones receive the help they desperately need. However, these measures often fail to address the root issue of inadequate mental health support. During a crisis, families often have no choice but to call the police, even though law enforcement officers may lack the specialized training needed to handle mental health emergencies. This can escalate situations in ways that no family should ever have to endure. We must find better solutions that prioritize mental health care over punitive measures. Another critical area where we're falling short is in our schools. As a former classroom teacher and behavior specialist, I witnessed firsthand that we're not providing our children with the mental health support that they need to thrive. We need more counselors, social workers, and psychologists in our schools to address these issues early and to provide preventative measures and support before they escalate. Without these professions, our kids face mounting mental health struggles with no outlet for help. In our communities, there is a shortage of culturally diverse mental health providers, leaving many families without timely access to care. By putting more mental health professionals in schools, we can help prevent kids from falling into the trauma to prison pipeline, offering them the support they need to succeed and thrive in life. I understand the heartache of waiting for help that never comes. I know the pain of watching a loved one suffer in silence and the frustration of seeking solutions within a broken system. The shame and isolation that accompany these struggles intensify the pain, leaving families to navigate these challenges alone without the support they so desperately need. You all have the power to change this. Please help us turn this pain into progress. Let's ensure no one else has to face mental illness without the support they need to heal. Together we can build a future where mental health is treated with urgency and compassion as it deserves. It is time for action and it is time for change. Thank you.
Thank you, Amanda. So in conclusion, we have heard some compelling stories today. I want to note that in such a polarized time for politics and for governance, mental health care is a rare opportunity for bipartisanship. The Right Health Right Now plan has been in progress. We're not done yet, though. We have some complicated issues to untangle, like workforce development. But there's strong bipartisan support on this because, as we say at Voices, the needs of the most vulnerable Virginians should transcend partisanship. So thank you very much, and we do have time for a few questions.
Real quick, thank you for holding this today. A couple of decrim for mental health crises. Is VACA on board? Is it VACA, Commonwealth Attorneys?
Well, I had no opposition. I had a pretty diverse stakeholder group, and as you know, in our juvenile justice code, we focus on rehabilitation. This is a point in an individual's life where intervention, support, and services can make a huge difference. It can change the trajectory of that child's future. So what my bill does is, usually a judge does have access to a case summary when they're making an adjudication. Before sentencing, my bill says the judge may also order another evaluation, and a comprehensive evaluation, and it talks about maybe the different types of assessments that could be ordered. I have not had any pushback. We were very careful in how we wrote it. A lot of it comes down to money, and that's why having, the governor's support, having robust support from the Democratic side, where we have put a lot of money into the spectrum of services, so we can really make a difference. So it's in finance right now, but we'll see.
Is the financial ask state staff to do the assessments, or the court?
It depends. It could be the court services unit, it could be the CSA, it could be the Community Services Board. So I'm not sure they're necessarily gonna come up with a fiscal impact, because it will be unclear, when it would be ordered and what agency would be ordered to do it. So they may get a non-determinate, and that would be fine, because then I can still get it out of committee. But I know it's important. The message here is diversion, support, diversion, support. So that's why I put the bill forward. And I do want to emphasize, we have done a lot regarding school-based mental health. We need to do more, but there's $15 million going out in grants now to schools to encourage them to demonstrate how they can easily connect one of their students to a mental health provider. And the school would be the conduit of that connection.
Is that right up right now from last year?
It's under a different name, but it's part of that rubric. Yeah, I mean, it's on the
Integration pilot.
preventive side,
Yes.
yeah.
But they're still facing the same workforce shortages as anybody else.
Well, yeah, I mean,
Yeah.
but hopefully in the way this grant program is working, sometimes the first assessment that the child is given could be done by a social worker, could be done by, a school counselor, and then a determination could be made that maybe treatment is needed. So we're trying to triage. We did put money in the budget a couple years ago that substantially reduces the ratio of counselors to students, and says the student should be doing the counseling. I mean, the counselor should be doing the counseling and not doing administrative work. So that was a big deal.
We have time for one more, and then we're happy to chat after as well. Thank you to our lawmakers for taking time out of the day.
Yeah, I wanted to ask a little bit more about some of the gaps that we have children's mental health. We do have mental health parity for insurance, we do have a public system, but what specifically are we finding are the kinds of things that youth need that we may not be doing that we'll do a good job on right now?
So, I'll use a very personal example in looking for, providers for kids in the Richmond region. To get a provider, it was at least 6 months to have somebody to be able to meet with your child, I tell people all the time, not all providers serve all people and meet all needs. I'm an attorney, I'm licensed to do it all, it doesn't mean I should or I do, right? You figure out where our gifts and talents are best utilized. And finding quality providers in this space, providing services to children in particular, is one that is very important, and there's a huge shortage of. And again, those are providers that even with these wait lists, it's still paying 100% out of pocket for those services in order to even be able to see one. So it's definitely, at least in the Richmond region I can speak from, is extremely important. And then the time slots for those is also very hard to find. Balancing instructional time for your kid, right, to not get them behind in school and to allow them to continue receiving the services that they need, so.
For these providers who would not ordinarily be covered by, say, a family's insurance policy, or?
They would be, but the dilemma is, like in all things, if you have a wait list and don't have to go through the bureaucracy of taking insurance and can charge a full rate and get it and still have wait lists, that's what people are doing. And I can't say that I blame them, because they have long wait lists and they're able to charge that full amount. It shouldn't be what we want. It shouldn't be where we are. We need to fix it. And that was part of my remarks at the beginning. We need to figure out how to get more quality providers back into our pools, accepting all types of insurance and ensuring every family, regardless of income or the insurance that you have available, is able to receive the same quality services.
I mean, I could ask more, but I think one-on-one is good to do that.
Yeah, and maybe we can do some one-on-ones.
Yeah, and this would just be real quick, would this bill support what's already in place, such as REACH, through the Virginia Department of Behavioral Health?
I think we've heard about a number of different bills and budget items that sort of all build up to comprehensive transformation across the continuum.
So it would also support REACH?
I'm not sure that we addressed a budget item for REACH today, but I can get back to you on that.
Okay, sounds great.
We do have a budget item in.
We do.
Okay, so yes.
The budget is still, it's in its very early stages. The governor has presented, the governor has presented his budget, but the General Assembly is now in the process of meeting and working through the issues, so.
Thank you. Thank you.
Thanks.
Anybody willing to take the, do you want to do medication combo?